president of the Greater Meriden Chamber of Commerce, and I'm also the current president of the Connecticut Association of Chamber of Commerce Executives. Until recently, I was also a small business owner of 18 years, and I worked in the banking industry for the 20 years before chamber biz. From my personal and professional hands-on experience, I know it is very difficult to run a small business. The odds are against you, and in fact, most small businesses close in their first 5 years. Obtaining and affording health insurance is very difficult, not almost impossible for small businesses. So when the Universal Healthcare Foundation first approached me about 4 years ago about working with them to find solutions for small businesses, I was intrigued, but I was a little bit skeptical. With almost 700 chamber members, I need to be very careful how I spend my time. And while the issue was very important to me and my members, I didn't want to embark on a wild goose chase. But after serious considerations, after talking to my membership, after attending briefings and reading up on this issue, I was really encouraged and struck about how the Universal Healthcare Foundation has considered my constituency, the small businesses, when considering this proposal. It certainly is not easy. Small businesses are as dissimilar as snowflakes. Each have 12 sides, but each are very, very unique. But of all small businesses, a few things are very typical. They do have very thin profit margins and not a lot of extra money to spend. They don't have a lot of time. They spend most of their time on task, on their job, and don't have the time to research things like health insurance plans. And they need themselves and their employees to be on task, as productive and as healthy as possible each and every day. I believe the SustiNet is a good program for small business. I believe the Universal Healthcare Foundation and their researchers have listened to small business, and I believe this solution can work for us. SustiNet helps our employees. It does not unduly burden us. SustiNet represents a shared responsibility model. Small businesses are always open to more choice to provide coverage for themselves or for their employees, as long as the costs are affordable and reasonable. And if we choose to buy it at a later date, we can once the program proves itself. I like the idea that we will be analyzing our successes and failures in adapting SustiNet to work at its best using real data and using effective approaches. I like the idea of the mental home, so complex care can be coordinated. And I like the idea that businesses, especially small business, has been at the heart of this policy change, and not only helps our bottom line, but also helps the communities in which these small businesses exist. Small businesses built this country. Small businesses where the jobs have come from and will continue to come from in the future, and I remain committed to the strength and the health of small businesses. We believe in big picture, we believe in solutions, we believe in finding a health solution that fixes the infrastructure, and I hope that you all will join with me and other thousands of small businesses out there and support SustiNet.